Let's talk more about COVID-19 because more people are dying in transit and it is becoming alarming. That's the worry of the Ghana Medical Association, which explains the increased cases in COVID-19 in the country is overstretching health facilities. The country has recorded 345 new cases, bringing its case count to 109,022. The current active cases 6,765 and 892 deaths recorded. Currently, 101,365 recoveries have been recorded. Let's analyze these figures. And joining me for this is Deputy General Secretary for the Ghana Medical Association, Dr. Titus Bayo. Doc, I'm grateful for your time. This has been your worst fear since the country entered its third wave. What's our situation now? Manageable, beyond repairs, or out of hand?
Good afternoon, Aisha, and thank you for having me. I would say that it is, but we are almost at the stretch limit. And we have episodes or days where we are inundated calls of people trying to find ICU beds and not getting, especially within the capital. So I should emphasize that this is not nationwide, but within Accra, we are having challenges in particular for...
Hello, Mr. Bayo.
Yes.
Great. So we're all happy when a government announced last week that it was going to intensify efforts to ensure enforcement of the protocols. Our checks hasn't really shown any positive picture out there. What else can we do? What differently can we do to deal with this situation?
Well, other than enforcement, I don't know else we can do. In this, our debacle is the enforcement of the protocol. And like you said, we've had the Accra Metropolitan Assembly and the regional minister for the Greater Accra region. And I also heard the Kumasi Metropolitan Assembly saying they were going to enforce the protocol. I haven't seen much of the enforcement in Accra yet. I don't know about the situation in Kumasi. But I think our best bet now is the enforcement of these protocols. Because the other arm is the vaccine. But as you know, we are having challenges with getting large quantities of vaccines to vaccinate the population over a short period of time. So our biggest let's say, chance to overturning the event of things will be enforcing the protocols.
Let's practically look at the picture in our hospitals. Paint a picture for me. How does it look now?
Well, I will paint a picture from the view of a patient. And I'll just give you an example. That yesterday I had a colleague call me trying to get an ICU bed for her mother. And this is a doctor. And she had called all the centers in Accra and was not getting space. This call started the day before. She was told to call some of the private, I don't want to mention names of the facilities, but virtually she called almost every center where you can have an ICU bed. And the man was having SpO2, that's the oxygen saturation, around 60-80% on non-rebreather max. So this is someone who would need intensive care. She was getting oxygen at the hospital where she is, but not having access to an intensive care bed. And that wasn't the only call I had the day before yesterday and yesterday. This is the picture that is on the ground when it comes to intensive care. Ordinary hospital bed you would get. Hospital bed to get oxygen you will get. But if it gets to the point of intensive care, at one of the places she called, she was told there were about 4 people waiting on a waiting list to try and get into the picture that I had from a distressed colleague who called. So I think Ghanaians need to know about this so that we can reform our behavior. Ask the agencies responsible to force us to behave well. If you know that your next illness, you may be stranded trying to get an ICU bed and may die of a preventable cause, I think you behave well.
So if I understand what you're saying, ICUs are currently full, correct?
The issue is that it's difficult to say that they are currently full throughout because it's episodic. So there's a time where you have an increased demand calling around not getting, but of course, it's not dying. So someone dies, a bed becomes available, but that bed suddenly gets full. But I can say on authority that 2 nights ago and yesterday morning, I had people calling, and I personally took part in the calls trying to find a bed for someone, an ICU bed for a colleague's mother in Accra here, and we're not getting. As at this moment, I don't know what the situation is. It's possible some beds have become free, but it just tells me that episodically we get to a place where the capacity is stretched beyond limit.
And again, paint a picture for me. How does the bed become free? Is it that a lot of people die before the bed become free, or they recover? How would you put the two?
Well, when you are admitted into an ICU, you have only one of two options. Either you die or you recover. It is a prayer that most people recover. But in the past few days, as you see on the Ghana Health Service dashboard, our death figures have been going up. So which means that people are recovering as well. Some people are also dying, unfortunately.
So if you say people are dying in transit, what exactly do you mean?
Sorry, I didn't get that.
If you say people are dying in transit, what does it mean?
People are dying in what? I didn't get you.
In transit. In transit.
Oh, no, I think what I said was that unfortunately, some people are being discharged. Unfortunately, a few people are also dying.
Okay.
And that's what I said.
So I want to understand that, is it when you are transferring people from one facility to another, or, I mean,
No, I don't think I have mentioned the issue of transport, like in transport from one facility to the other.
Okay.
What I have said is that when people are admitted to the ICU, you have two options or possible outcomes. Either you or you are discharged. And I said that as much as people are recovering and being discharged, unfortunately, a few are also dying. And that is why we see with the increase in death figures on the Ghana Health Service dash, which if you go there now, you will see that our mortality figures are inching up over time.
Okay.
And that is the only way by which an ICU bed becomes free. Either someone gets well and is discharged, or unfortunately dies.
So as it stands now, what is our last bet, and what differently can we do? Because it's obvious the vaccines are not in yet. It's obvious that people are not obeying the rules. What do we do? Are we going to sit and fold our arms and watch the people die?
Well, I think there's still a lot we can do. But the end result of all of that, like I mentioned, the low-hanging fruit here is the enforcement of these protocols or adherence to the protocols. So how can we get that in? We must change our communication. We must let the people know what the situation is. People should not have a feeling that things are as normal. You may go for that party, you may disregard the protocol, have that wedding, go and sit at the reception, but the next day, if you need an ICU bed, you may not just get one, and you may end up dying. So that must come to everybody's attention.
Doc, clarify this for me before I leave you. Which of the variants are we seeing? Is it still the Delta variant?
Yeah, the predominant.
Dr. Titus Bayo, he's Deputy General Secretary of the Ghana Medical Association.